Well, here we are again in lovely Houston, staying at the MD Anderson Arms, the very best accommodations in Houston. If you're visiting, you should definitely book a room. Hi, everybody. We're back in Houston, and I am sitting in the room with Ann, who is across from me knitting. Hey, sweetie.
Hi.
Okay, so this is our first video blog since getting back. I want to give everybody a little rundown on what's going on.
Of course. Let's see. At some point when I got released, I was infected with Epstein-Barr virus, and that led to PTLD, which is pre-lymphoma. So I have pre-cancer. So here I am at MD Anderson, passing the time knitting and getting Rituxan and all of these lovely bags of antibiotics and saline mixed with vitamins and things.
And you have a lovely new line, too.
Oh, yes. As most of you recall, I used to have a central line in my chest, and I have lovely scars from the removal, and I did it. So they elected to put in a PICC line this time, which goes into my arm, and there is a beautiful, beautiful tube that feeds into my arm, into the vein, and up into my chest. This one is a little bit achy, but I have to tell you I prefer it in my arm than in my chest because it's a little less freaky. But this one has to get, the bandage has to be changed every 3 days on it, and I have to remember not to roll over on the tubing when I'm sleeping, which is kind of tricky, but I shouldn't complain because it could be worse.
So, how does your blood work look today?
Well, my red blood cell count is 2.84. My hemoglobin is 9.2, and that's up from where it was.
Yeah, your hemoglobin was going in the toilet.
Yeah, I think that was from the viral load I was carrying, and I mean, the Rituxan must be doing what it's supposed to be doing.
What was it, 172,000 DNA copies per microliter of blood?
Yeah, that's how much virus I was carrying. My absolute neutrophil count is 3.26, which is right in the middle of normal. My magnesium is low again, and everything else is normal. So things are headed in the right direction. The pseudo tumor in the side of my neck seems to be disappearing. The doctor seems pleased whenever he palpates it. He says it's starting to feel empty in there, so I can only assume he's happy. I don't know about the mass in my sinus cavity. I can tell you I still only breathe out of the right side of my nose, which is interesting, and I'm sure I snore like a freight train while I'm sleeping, but nothing I can do about that. Hopefully the Rituxan is doing something to diminish it, and if not, hopefully they go in to take it out, because it's creepy to think I'm incubating a triple up there.
But this isn't, I got a disclaimer, this is anecdotal evidence, or speculation on our part, I guess. But we do have some stuff to report about Ann's condition, which could be more or less positive. We don't know exactly.
You're not going to tell him I blew my nose.
Well, you just did.
Yeah, well, okay, everybody gloss over that part. Move along.
Oh, okay. Actually, I was going to say your diet is getting better.
I was able to eat a full meal yesterday, a small full meal, but a full meal nonetheless for myself. And it was very, very nice not to get a stomach cramp or to immediately feel sick or throw up. Bonus. So.
Yeah. Well, the reason you're getting stomach cramps and sick is because you're yeah, the right colon, transverse colon, and descending colon are all marked with edema. In layman's terms, it means they're all swollen, and they're all
tumors.
Well, they're all infiltrated by the lymph nodes in her abdomen, which all show the same kind of necrosis that's in her neck. So
they're full of tumors.
It's creepy when you smile like that.
I have to have a sense of humor about it. There's nothing else I can do. Sorry.
Okay, so
Oh, Paige, happy birthday. I'm going to be stuck in the hospital while you celebrate. Bob, super happy birthday to you. And happy birthday to me. I'm going to be stuck in the hospital. I asked the doctor tentatively when I would be allowed out, and he said I'd be here for the rest of the week. So I'll be celebrating in this luxurious hospital gown, which is not half bad.
and the wonderful accommodations.
That blue band on the door over there is Chris's attempt at getting me to lift weights. Pick line.
Okay.
Chris is at a loss for words because he's been trying to get me to use the blue stretchy thing. I have been walking, though, in my defense. I have been walking. I have a really hard time.
Chris doesn't want you to get pneumonia.
And doesn't want pneumonia either. I have a really hard time exercising because I can only breathe through the one nostril. It's hard talking and breathing at the same time, too. So,
Okay.
You do what you got to do.
All right. Well, on that note, we're going to say goodbye, and we'll do another blog tomorrow or the next day. Monday, we have another dose of Rituxan.
Tuesday, I think.
Tuesday, and there's going to be some more diagnostic imaging. So, everybody who's reading our blog, we miss you guys. We miss Baton Rouge. This is a real unexpected complication, and it's a serious complication. We don't know what it's going to mean for the future, or what we're going to have to do. But we're thinking about you guys.
Thank you to the CSA for your donation. I really, really appreciate it, and I really wanted to write a thank you note, but then this happened, and I'm stuck here. I'm really sorry, but thank you so much for everything you guys have done.
Well, hopefully Monday, Tuesday, or Wednesday we'll have some more concrete information on what's going on after they do some more diagnostic imaging and they see how the Rituxan's going. So, and that's about it. So, good night, everybody.
Bye, everybody.